Hello everyone, you are watching now, your medicine videos channel. In my previous video we discussed briefly about paracetamol. This is the second part of paracetamol. Now, without wasting any time, let's start. Paracetamol is also known as acetaminophen, is a medication used to treat pain and fever. Let's discuss the types of paracetamol. You can purchase most types of paracetamol from pharmacies or supermarkets. Some types are only available on prescription. Paracetamol is also available in the form of tablets, capsules, liquid, suppositories, and an injection given into a vein, normally only used in hospital. How to give paracetamol to an adult patient. Paracetamol can be safely given to the patient, but there is a limit to the amount of paracetamol that can be safely taken in a 24-hour period. Giving more than the daily limit is very harmful to the liver. Adults can usually take paracetamol 500 mg 1 or 2 tablets every 4 to 6 hours, but shouldn't take more than 4 grams. Means not more than 8 tablets of paracetamol 500 mg in the space of 24 hours. Wait at least 4 hours before giving the next dose, for example, 8 a.m., 12 p.m., 4 p.m. and 8 p.m. Keep track of the timing of the doses and check when it was last given before giving it again. How to give paracetamol to babies and children. The dose of paracetamol is based on your child's weight and not their age. The recommended dose is 15 mg per kilogram every 4 to 6 hours to a maximum of 1 gram per dose, and no more than 4 doses in a 24-hour period. As your child grows, the dose of paracetamol will need to be increased, based on their weight, to ensure that they are getting the correct dose. The dose for each child is based on their own weight. Do not use the same dose for each child unless they are the same weight. If you are giving paracetamol to your child and are unsure of how much to give, always check with your pharmacist. When measuring the dose, measure the right amount using an oral syringe or medicine spoon. You can get these from your pharmacy. Do not use a kitchen spoon as it will not give you the right amount. Now, let's see liquid paracetamol. There are 2 strengths of liquid paracetamol. Number 1, 120 mg in 5 ml, which is considered as lower strength. And number 2, 250 mg in 5 ml, which is considered as higher strength. Your doctor will prescribe which one is best for your baby or child, according to their weight and age. How to store paracetamol. Keep all medicines out of reach of children. Paracetamol does not need to be kept in the refrigerator. Let's discuss about the paracetamol overdose. Paracetamol is a very popular medicine, and when taken correctly, it works well. However, too much paracetamol is very harmful to the liver. If you realize you have given your child too much paracetamol, including other products with paracetamol in it, call your doctor immediately. Do not wait for signs of an overdose, as these appear late when damage to the liver is already done. Late signs may include nausea or vomiting, diarrhea, yellow skin or eyes, poor appetite and confusion or extreme sleepiness. So, that's it. I hope you have learned and enjoy the video. Please like, share, subscribe and click the bell icon for more updates. Thanks for watching.